Hello guys, this is Deepak Mishra, and today I had my first 24 hours duty as a Notarzt. Now Notarzt is an emergency doctor who, in case of emergency, has to go in the ambulance to the place where the emergency is. For example, it can be a heart attack at home, it can be a trauma, a motor accident on the road, it can be a train accident, it can be any kind of someone drowning in the swimming pool or drowning in the water somewhere, so a fire somewhere. So any kind of emergencies, medical emergencies that are outside, and that has to be the patient has to be brought to the hospital, has to be managed outside with the limited resources that they have outside and brought to the hospital. That is the work of the Notarzt. Now, as you can understand, since it's a multidisciplinary, unknown situations, the work is very, what you say, challenging, and it requires a certain training. I have been working towards it since, I would say, a couple of years. I've been doing this. I've been training myself. I've been doing extra, like working with people as hospitant to learn those things. And today I had my official 24 hours duty. I was very, very, very nervous about this. Last couple of days, I have been going through books, through articles, through different experience of different people, so that because you never know. Even now, I have 2 hours remaining in my duty, and I don't know what is going to come in these 2 hours. But my last 22 hours have been so relaxed and peaceful that I feel that next 2 hours will also be like this. And with this hope, I'm making this video. um, I have a pager here. This can go off anytime, and as soon as it goes off, I will have to run. I'm already wearing my shoes, and I'm in since 22 hours in this position. My jacket is hanging as a notards. I'm wearing my shoes, and I'm all ready. As soon as this pager goes off, there's a wagon, there's a ambulance outside. The driver of the ambulance is also in the neighboring room. So he also has a pager. As soon as this pager goes off, we will get a one-liner or say two words. What is it for someone with chest pain, someone with bleeding, someone with trauma, for a motor accident? So that will come, and we will run to the vehicle. The driver will drive. He will have the address. He will drive to the place, and then we will manage it. So this is how we'll manage it on spot, and hopefully bring the patient living to the nearby hospital which has that competence. So last 22 hours, today I can call it, it's a beginner's luck. I had only two cases which were also standard cases of chest pain and GI bleeding. So I, being an orthopedic surgeon, treating chest pain, treating heart attack is not my forte, but that is what the thing is that I was trying to emphasize, that you have so many versatile things to do that makes the job very cool. Like, you don't know, the next hour you might be delivering a baby somewhere, or you might be saving someone who is drowned in the water, or you might be helping someone who has a gastrointestinal bleeding, or someone who has a knife in his eye, or something. Any kind of medical emergency can come to you. You're not restricted to your branch. So that's why I find your job very cool. And yeah, it has been a very nice duty, nice first duty. I hope the next duties are also good. But I just wanted to make a short video on my first experience as a Notarzt. It was two standard cases. The team that I had was very nice. You go with your driver, who is very experienced most of the times. He has seen, we work as Notarzt maybe once or twice a month, but he is working like almost every day, working much more than us. So he has seen many cases, many things, how different doctors have treated different situations and how it has turned out. So they have very good experience, and they are also very helpful most of the times, if you are nice to them, obviously. That I am, as usual. So yeah, and then you have the ambulance, where you go in a small vehicle, where two-seater, but then there's the other big ambulance which is coming, which carries the patient. So there are in total four people in a normal situation, where when there's a patient, and then that, like, your driver, and two Rettungspersonal who come with the big ambulance. That way it is a system in Rettungsdienst. Yeah, okay, good. This was about my first day as a Notarzt in Germany. Here, I have been thinking about the videos, the concepts of videos that so far I have restricted to making videos only about PG in Germany. And I think most of the areas, the broad concept has been already cleared, and making repetitive videos about same things again and again does not make fun. That's why I've not been making video like I make one video in 2 months or one video in 1 month or something like that. So I was thinking that the time when I started this YouTube channel, I started it to share the information that I had gained towards approbation, towards Fachsprachprüfung, towards the entire process of application, getting jobs in Germany as a doctor. So that was focused to that aspect, and I started in 2016. Now in last 6 years I have come quite forwards, and uh, now apart from that, my quest is towards building a business, building learning about finances, learning about different aspects of management. So I have developed a new hobby about listening to audiobooks. So my thought was that why don't I document or tell you guys about what I am learning, what I'm doing, and things that is not about, it's not about me, that what I'm doing, about the things that I find will be useful to you also, probably when you know about it. So that was a thought that I should make more videos towards other things as well, apart from just PG in Germany. You guys will tell me, is that a good idea, or I should just restrict to the PG in Germany aspect that this channel has been restricted so far, or do you think that's a good idea to little add to the spectrum to the of the channel? All right, do let me know your comments. I will mention, I will write back to you in comments, and I will consider your points, because I have not many subscribers, but the subscribers who are there are very loyal subscribers that I come to know through my free webinars, through the questions that I get on Facebook and in email. So I know that you people watch my videos. All right, have a nice time, and do let me know what do you think about increasing the spectrum of this channel. Bye bye. Have a nice time.